Hi, welcome to Markey Presents Your Key to Healthy Living. And I am your host, Karen Halloran, and I am the community liaison for Marquis. And this show is going to be evolving. I'm out in the community and I'm hearing from a lot of the seniors that you have questions and sometimes you just don't know what your choices are and that you have options. So I've decided to start a show and bring people on here that can answer your questions, whether it be services, products, different situations that are arising for seniors. So for today, I brought on my boss, Marlene Sheehy, and thank you for coming on the show.
Thank you. Thank you for having me. Appreciate it.
So maybe you could tell us a little bit about what your background is, Marlene.
So my background, again, my name is Marlene Sheehy. My background started as a nurse, a registered nurse, went to University of Massachusetts in Lowell, started my career at Holy Family Hospital in Methuen, and someone approached me asking me if I'd be interested in the skilled rehab facilities, and I really didn't know anything about it because I was a floor nurse and my job was with patients every day. So she said, you got to come, you have a great personality, I really want you to come and check out this facility. So I went and interviewed for a position as a director of admissions, and that's what brought me into the arena of skilled nursing and rehabilitation.
That's great. Kind of a same story as myself. I got involved as director of admissions back years ago, and I think it just kind of, if you love this field, you just really get involved in it.
You do.
There's a lot of young people as administrators and executive directors that are rising up, and they're young. There's a lot of young people going into this field. So maybe you could tell us how what you do on a daily basis, what your job involves.
Sure. So my job title, as you know, is Vice President of Business Development, and I am fortunate enough to have great people like yourself working with me. Your job obviously is the Community Marketing Director role, and your job is to get into the community to talk about all the services that Marquis Health Services has. And I also have clinical liaisons that are stationed in the hospitals, and their main position is to ensure that they're getting the education to the patients and or family members that might need rehabilitation services. So they're stationed at every hospital so they can assist with giving information about Marquis Health Services in the facility. So my role is to direct them on a daily basis, think strategically, work with area hospitals in Massachusetts and Rhode Island. And my job is to make sure that we're servicing the hospitals and the community from that level as well.
Fantastic. There's just a lot of terms out there, and you have said a few of them. So I thought maybe we could start like an ABC 1, 2, 3.
Sure.
People, refer to a nursing home as a SNF.
Correct.
It's not SNF, smell.
Right. No.
What does it stand for?
So SNF, as you call it, is skilled nursing facilities. And you also alluded to the fact that people call it a nursing home as well. So Marquis Health Services, just to give you a little background about Marquis Health Services, we are in the Mid-Atlantic region as well as New England. And under my belt is the New England region. I have 9 buildings in Massachusetts and 1 in Rhode Island. We are stationed in local communities really close to area hospitals as well as Boston hospitals. So people often say nursing home, and they don't necessarily realize that there's short-term rehab services available in the facility as well. So STR, LTR, that means long-term care services. So we have both short-term availability for patients that need physical therapy, occupational therapy, and or speech therapy for a short stay, and then they go home. But we also have services for people that might need a respite stay and or people that need long-term care services.
That's great information. People are often asking about insurance. There's a lot of confusion. People say, well, there's Medicare and there's Medicaid. Right. There's confusion. They don't know which one is which covers the stay.
It is very confusing. It really is. It's really hard to explain sometimes to people as well because it is really confusing. Hospital case managers will typically give the insight to the families and the patient members as to what is covered under insurance, but typically if you're over 65 and you do have Medicare, it could cover up to 100 days. And I say up to 100 days because it doesn't necessarily mean you get 100 days. I think that's sometimes a misnomer that people don't realize, that it doesn't necessarily mean you get 100 days. You have to qualify. So you have to show progress, that you're progressing through physical therapy, occupational therapy, and you're doing well and getting to the next steps. There's also commercial insurance. They also assist you with care, but you have to meet specific criteria that you can participate in physical therapy and occupational therapy. So there is many different insurances, but you have to meet certain criteria.
So there can be a lot of confusion.
Yes.
So there's a lot of people out there that can help if there is confusion about insurance and help you navigate the healthcare system.
Yes.
There are geriatric care managers. They're now called life care managers. They're out there, and that's somebody that you can hire that will help you, navigate through the system.
Yes.
Also, estate attorneys, estate planning, they will help you. And they'll get into about Medicaid and the Medicaid look back, because people think sometimes another misconception is, well, I just qualify for Medicaid. There's a look back period. There's a lot that goes into it.
Right. It's very confusing. We also, in our facilities, in our 10 homes in New England, we also have admission directors that are also stationed in each facility, and we can answer any question. If people have any questions, they're always welcome to come in for a tour. You do not have to set up an appointment. You can come anytime and meet with the admission director, and they'd be very helpful in answering some of your questions as well.
That's great. Maybe you could, if somebody is looking for a skilled nursing facility, what should they look for?
So you started the program with saying a sniff, and it made me think of people often want to make sure that it doesn't smell in nursing homes, because that's another misnomer, that people say that nursing homes smell, they don't smell well, and that's obviously very important. And I'm proud to say that our facilities are very clean. Most of them have been renovated. If they're not renovated, they're in the process of being renovated, because we want to have a very positive environment for people. So one thing is I always recommend is people to tour. I think it's very important so you can understand what your loved one's needs are and or your needs are, because sometimes people will tour prior to them going in for surgery. If they've have a scheduled hip or knee, people will come in prior to and set up their stay prior to. So
kind of like pre-book it.
Pre-book it, yes.
That's a great idea, because that takes out some of the unknown when it's an emotional situation at the hospital. So if somebody has an opportunity, it's probably a good idea to tour beforehand and do that.
Yes, it's very good. So it's very important to meet the rehab team as well. I think that's very important. So you go and look at the gym and look where you'll be working out and kind of get an understanding of the people that you'll be working with, because I think that's really important to make you feel comfortable. And always meeting with the executive director. The executive director is, probably you can liken it to, as the CEO of the building, and their job is everything in that building. They have to make sure everything's up and running and smooth.
Pulling the whole team together.
Pulling the whole team together, so that they have an executive director, they have directors of nursing, they have assistant directors of nursing. So those key people are really important for you to meet on that tour. I often find that people sometimes cannot tour because everybody's busy. We have such important jobs that it's not that easy to get out. People are running around. So we've created on our website mini tours on the facility, so you can get an idea of what the facilities look like, so you have kind of an idea, and then you can have a call with the executive director to answer some of your other questions that you might have.
That's great.
Yes.
It's so many questions that go unanswered out there, and people have them and they don't know where to go. So it's our hope with this show to have you be involved. You're welcome to send us an email. You can put it to my attention, khalloran@mhslp.com. We're going to have people on here that are going to be able to talk about hospice, home care, attorneys. We can have people that are from the town that can talk about senior scams that go on, safety at home, allergies, sun protection. We also have a lot of specialists in our buildings, so you could talk a little bit about that, Marlene.
Sure. So our buildings, like I said, we're short-term and long-term care, and in our short-term units, we have specialized programs in each of our facility. One of them is what we call a cardiopulmonary program. And with the cardiopulmonary program, we have cardiologists and pulmonologists that are on staff that will come in once a week and see the patients to ensure that their cardiac needs are being met and their pulmonary needs are being met, lungs, pulmonary meaning your lungs. So we really pride ourselves in aligning with specialty physicians because we really think it's very important. We have physical medicine physicians that are affiliated with our facilities as well. They're there a lot more often because they oversee the rehab of the patient and meeting with the family. So we really pride ourselves on having respiratory therapists on staff as well.
That's excellent.
It
And in
really
future
is.
shows, we can have them on and they can talk about their specific disciplines.
That
would be great.
Yes, and talk about the programs in a little bit more depth and what to expect if you're a cardiopulmonary patient, if you're a neurology patient. We're fortunate to have top neurologists on staff with us as well. We have amazing physician coverage, which benefits the community and keeps you in line with your hospital as well, because we like to build that continuity of care with your hospital, from the hospital to the rehabilitation to home. We find it very, very important for the patient's needs to be met.
Well, thank you so much. It was very informative having you come on and explain some of these things.
Great.
You know, we just really want you to know you have a choice out there, and we're going to bring the choices to you and then let you make a decision. Thank you for joining us today. We look forward to seeing you the next time, and have a great day. And thank you, Marlene, for coming on the show.
Thank you very much. Thank you for having me.